Financial Management of Healthcare Organizations by Amanda Inman. First things first, introduction. Healthcare is one of the most rapid growing industries in this day and age. With the change in technology, it seems like healthcare is changing something every day. Let's discuss a case study regarding Boston Children's Hospital. They are recognized as one of the most high quality care centers for children in the world. Boston Children's Hospital is set to increase its share of the global market for children's healthcare services. The Objective by the author Kirshner in 2013. We needed to get our arms around how to best measure our international business information flow and ability to process our patients in a timely and effective manner. As an American hospital that has never done business before overseas, we'll have a challenging time collecting international healthcare business data. They're not over there to see this, to collect this data, and to compare it. And it's very hard to compare different countries. Every country does things a little differently or a lot differently. And for the Boston Children's Hospital to correctly get business data could and will be an issue. Summary of financial statements. Every section and category that needed to improve for the Boston Children's Hospital did in 2009. Their assets increased, their cash on hand increased, their assets REC increased, even the plant and the amount of equipment the hospital had increased, which means that they were using the equipment more, they needed more equipment per patients that they were having. Everything that needed to increase did. All possible numbers that needed to go up to make 2009 a more successful year than 2008 happened. So let's go on and discuss those numbers. As you can tell, here's the graph for Children's Boston Hospital. First, I want to point out our net patient revenues. Looks like right here was 10,778. This was the only category that it did go down a little bit right here. Other operating revenues, 23749. Over here, 253,517 went up, totaling some expenses, our operating expenses, 10,681,112. It looks like that down our operating expenses, which was good, 9.4%. Operating income, let's look at this and discuss this. Operating income, 330,909 to $1,054,186. That is huge, huge, huge. Last and the most important of all the numbers is the total assets. In 2008 were 87,000. 2009, the total was 99.5 thousand. That is a 1,025, little over 1,000 increase. Let's keep these numbers improving and growing to keep building the hospital successfully. So as I mentioned before, the total operating expenses, how we calculated that 9.4% is with this analyst. You take away, it looks like the 2009 year, subtract that by the 2008, divide that by the number that we had calculated for 2008, times 100. So it looks like an increase of 9.4%. That is huge. The actual ratio outcome for total operating expenses is higher. This method should be used over other methods because this outcome is always correct. It gives you direct numbers, and it's very easy to use and calculate. All right. Some findings of capital management influences. Capital decisions in the workplace are a very important part of the industry nowadays. After our recession years ago, it made it more difficult for today's world to have and help healthcare expansions regarding financing in this economic climate and financial issues with expansions, because financing companies need to take a look at the company's past and current performance and need to make projections that the risk outweigh the benefits. And in most cases these days, this is not the case. So they are stating that we do need to take a look at the company's past performance, and because of the recession, some companies have not made an improvement yet. Some don't have the funds to do so, so that's why they're reaching out to these other industries to get financing. So it is very hard. It is very hard for these companies to get the financing because they don't have the numbers to prove. And like it does say, projections that the risk outweigh the benefits, and in most cases, due to the past, that is not the case. Okay, moving on. I want to discuss electronic health records, my recommendation, and the outcome of that. As it states, in the world we live in, we have transformed by digital technology. Hence the phone that I'm using to take this PowerPoint, as well as the computer I am using in the PowerPoint and my presentation. Not only in our workplace or at school, but in our everyday lives. Smartphones, tablets, we have answers to every question at our fingertips. How many times do we use Google a day? So if everything we do on our own, it's digital, why not make our medical records should be digital too, right? EHRs are just that, and it stands for Electronic Health Records. It is a digital version of a paper chart that contains all of the patient's medical history. Well, what does that contain? Electronic health records contain our personal information, our name, date of birth, social security number, where we live, our phone numbers, emergency contacts, records of our medical exams, anything from 3 years ago to our flu test. If we got the flu swab last year, they would have those records in there. Our test results, if we've had any tests done, such as x-rays, MRIs, everything is in the system electronically. So they need to pull something up from 2 years ago and it was scanned in there. Then we are able to look at those results. Our consent forms, any referrals or specialists that our primary doctors have referred us to would be in there. Our prescriptions and our refills, which is very convenient. All of your prescriptions, how many times have we gone to the doctor and have not known what prescriptions we're on or what the dosage is? It's all right here. So the doctor that you are seeing or in the emergency room is able to see this to make sure that prescriptions are given do not interact with each other. We do see the diagnosis in there, anything from simple as, like I mentioned, the flu test swabbing to strep throat, anything serious to cancer. Any type of diagnosis that was ever given to us would be found in these electronic health records. Documents of any complaints. Every time you do go to the doctor, they are recording and writing down and keeping track of any complaints that you might have. Complaints such as a cough to a fever to a stomach ache to chest pains, anything above. Also, what are results from the doctor, even such as medical assistants or nurses that are taking these notes. writing all this down and then coming up with a results for the patients. Like I said, at the doctor's office, at the quick care, to the hospital visits, to specialist office. With EHRs, you are able to contain all this in one spot. Now let's talk about all that information and what are the benefits. Some benefits, not all, are the improvement in patient care. As I stated, all that information being in one spot, it's more convenient, it's more, the doctors can see the communication between other doctors, as well as obviously what the diagnosis was. Rather than calling around, it saves a lot of time, a lot of energy, a lot of effort. It's all right here. Also, improvement in care coordination. As mentioned, doctor communication. Actually, in EMRs, you're able to see doctor reminders. If you were referred to a specialist, you can see that on the accounts when you log in, some phone numbers, ask questions, get your test results. Everything is right here. So you're able to have control over a little better of your medical record, ask questions, get answers, just a more better care coordination using these EMRs. Obviously, as I mentioned, improved diagnosis and patient outcomes. This EMR save time, money, more convenient. They are just one of the best things that has come to the healthcare industries. Should have happened a long time ago. It's effective, cost savings, and it does increase in patient participation, such as if something was wrong, we will hear about it from the patient, as well as if they have questions or answers or need reinsurance, and we can just figure it out through the EMRs. Here's a couple stats that I want to go over with. A national survey of doctors done with www.healthit.gov. See why it is already effective and already important. 79% of providers report that with an EHR, their practice functions more effectively. 82% report that sending prescriptions electronically saves time. 68% of providers see their EHR as an asset in recruiting physicians. 79% receive lab faster sooner and results sooner. And 70% report enhanced in data confidentiality. Alright, see a little EHR, someone's x-ray, they can look at it right there. Conclusion, our world has and is still becoming electronic and paperless world. The sooner the company of DATS, the better. It is a known fact, as we just mentioned, the effectiveness of it, how effective it is. It's the first and foremost about reducing and containing our healthcare costs. It's our most important goal. Improve in patient care and save money while doing it. So, any questions, please reach out to Amanda Inman. My email is right here. I look forward to hearing everyone's feedback. And thank you for watching my presentation. Have a great night. Bye-bye.